and medication refills, lab results, scheduling, and some of these are like, I need to speak to my doctor about an upcoming appointment. So we looked at that information. That data was pretty compelling to look at, say, wow, we now have a way to streamline this information and make sure that these patients can actually talk to somebody who can answer that question and then resolve it on the spot. And now you got to take the next step to say, now, how can we automate this? We started to think about, okay, now we have to think about how do we integrate this within our electronic medical record workflows so that our staff don't have to just constantly create these communications to say patient call for XYZ, patient call for XYZ. Rather, the AI is taking that information and creating that communication where it needs to go to, and our call center staff are addressing the most complex needs of our patients who are calling and want to reach a live agent over the phone.
I think that's, certainly the most common way to evaluate it is looking at those metrics that we look at. But I think what you guys did to really look at that data, right? And what information, what are these common calls? And, we've all had the experience, whether in healthcare or in other industries, where you have to ask your question or tell your story about why you're calling a million times to get to the right person and to get it resolved. Right. And so by having that information and tweaking workflows and then building the automation around it is really impactful for, both your staff to not have to maybe handle some of those things that it could be a simple resolution, but also for your patients to get to the right person when it is a more complex need. So really that's a really strong way to use those tools, to leverage those tools. So as we're wrapping up today, I want to just highlight a few of the key takeaways and ask if there's any other, last pieces of wisdom that you'd like to share with other FQHCs that are embarking on this journey or maybe in the early stages. So I think some of the things that I heard you say that really stand out is really that importance of first defining the problem, right? There's so many really sexy new tools out there that, you see a demo and it's exciting, but, as you guys did, sitting down with your team and understanding these are our priorities and really there's all these problems, but how do we prioritize that? So engaging the key stakeholders from both executive leadership, operations, frontline staff, really pivotal to define that priority use case or use cases. You talked about creating a governance around the AI solutions and the steering committee and your team being able to really to be in the weeds and understand how this is going and really building that in as an initial step. As we just talked about, evaluating the data that the tools are giving you and how to leverage that to really improve the whole workflow, whether it's related to the optimizing the AI, but just creating the workflow and then being able to accelerate it with automation. And I think one of the really very simple things you said, but I think have a profound impact of the reason you guys have been able to bring in multiple pilot use cases now is how you have approached it, right? Start small, measure success, and then scale from there, right? Not trying to boil the ocean, but taking that one facet of it, starting it after hours, and then expanding it to a few hours during the day, and on and on. I think that's really a great guiding principle for other FQHCs. So, other than those key takeaways, is there any last nuggets of wisdom you want to share with the group?